Hello, Laredo ISD family. Welcome to your 2021 open enrollment. This year, we're doing things a little bit different. Instead of having our traditional face-to-face enrollment, we will now be doing everything via electronically. Our enrollment dates are October 12th, 2020 through October 23rd. The effective date for all your plans are on January 1st, 2021. My name is Blas Martinez. I am one of the partners here at Laurel Insurance Associates. I'm here with my partner, Tina Cerda, and we're going to be discussing some of the items some of the options that you'll have here at Laredo ISD for the upcoming enrollments. Very important, all applications must be turned in at the Veterans Field Ticket Box, which is located at 2200 Santa Maria Avenue, anytime from 9 a.m. to 6 p.m. on the following dates, October 12th through the 23rd, Monday through Friday. This year, you have several options as far as your benefits are concerned. Your ancillary benefits are going to stay the same, but there are several new options for the medical plan. And I'm going to pass it on to Tina so she can go over some of those plans.
Hello. We're going to go over each plan in greater detail in a moment, but this summary sheet gives you a very good idea of the three choices that you have effective 2021. The Gold Plan and the HMO Blue Essentials Plan, that one is new, are practically identical. The big difference between the two is that the HMO Blue Essentials is a Texas-only plan. So if you have family members that live out of state and are on your insurance, this is probably not the right option for you. So the Gold and HMO Blue Essential plans both have an annual deductible of $3,500. The Silver plan has a $3,000 deductible. The annual out-of-pocket, this is the most that you will spend in a calendar year on your medical expenses, is $8,150 on both the Gold and the HMO Blue Essentials, and it's $3,000 on the Silver PPO. I invite you to really examine how much money you spent last year or in the previous years on your health care to determine which of these out-of-pocket maximums best fits your family's budget. The Gold PPO and the HMO Blue Essentials both incorporate copays at your physician's office. Your primary care physician copays are $40. Your specialist copays are $60. Urgent care copays are $75. And the Gold PPO plan incorporates virtual visits using MD Live with a $35 copay. The Silver PPO plan does not have copays, meaning that you must pay all of your expenses once you reach that $3,000 deductible. From that point forward, your expenses are covered at 100% for the remainder of the calendar year. Your emergency room coverage is going to be a $300 copay on the Gold plan and a $300 copay on the HMO Blue Essentials, plus 30% of the cost after you've met the deductible. Keep in mind, a trip to the emergency room can be very expensive, and we encourage you to use the emergency room for true emergency only. The preventive screenings are covered at 100% under all three plans. That's a federal mandate. So any of your preventive screenings, mammograms, pap smears, PSA tests, even colonoscopies where no polyps are found will be covered at 100%. You will pay nothing for them. Your prescription drugs under the Gold plan and the HMO plan will be covered with a $20 copay for generic medications, $40 copay for name brand, $60 copay for non-preferred, and a $250 copay for your specialty drugs. Under the Silver plan, all medications are covered at 100% after you've satisfied that deductible. Now, please take a special look at the out-of-network benefits and notice that the deductible is double on the when you use out-of-network facilities. So please try to stay in network. Under the HMO Blue Essentials, there is no coverage if you go out of network, so those expenses will be 100% at your cost. The monthly deductions reflect a $525 per month contribution by the district. You'll notice that the most affordable plan is the Silver PPO at $88.65 for the employee only, followed by the HMO Blue Essentials at $135.23, and the Gold plan at $149.52. Those of you that are currently on the CDHP plan will stay in the CDHP plan. And those of you that are in the current high plan must make a choice and select either the Gold, Silver, or HMO. In the subsequent slides, we're going to go over each one of these plans in greater detail.
The Gold PPO plan is a plan that most people are familiar with. The majority right now of the employees at Laredo ISD are either on the low plan or the high plan. And this is a plan that most people are comfortable with because it's the PPO plan. PPO stands for Preferred Provider Organization. And as Tina mentioned, if you go into the hospital, your annual deductible is $3,500. That deductible runs from January 1st to December 31st. Your coinsurance is covered at 30%. The out-of-pocket maximum is $8,150. And again, if somebody were to have a procedure done, let's say a heart attack or a stroke, and the bill was $150,000, the maximum the member would be responsible for paying is $8,150 if you are in the network. If you go out of the network, you will be subject to higher fees plus balance billing. So always try to stay in the network when possible. Office visits with your primary care doctor are covered at $40. If you go see a specialist, the copay is $60. If you go to an urgent care center, we have several of them here in Laredo, Texas, the urgent care copay is $75. You do have access to the virtual visits or MD Live. That's available 24 hours a day, and that is covered with a $35 copay. If you visit the emergency room, that has a $300 copay plus 30% of the bill after you've met your deductible. As mentioned earlier, preventative screenings are covered at 100% of the cost, and your prescriptions are covered for generic drugs, $20, brand name, $40, non-preferred brand, $60, and the specialty drug medication is covered at $250 a prescription. The fees, the monthly deductions for the employee only is $149 with 52 cents. Employee plus spouse is $782 with 45 cents. Employee and one child or with children is covered at $655.49. And employee and family, the fee is $1,430 with 98 cents.
The Silver PPO plan, also called the CDHP, works a little bit differently. Under this plan, you have that $3,000 deductible. Once you've met the $3,000 deductible, and this is for in-network benefits, all of your expenses for the remainder of the calendar year are covered at 100%. As Blas mentioned, the calendar year runs January through December. That's also your plan year. All of your office visits, all of your prescription drugs will be your responsibility until you meet that $3,000 deductible, which is also your annual out-of-pocket. If you go out of the network, you'll see that your deductible doubles and your out-of-pocket triples practically to $10,000 per individual and $20,000 per family member. In addition, you are subject to balance billing, which represents the difference between what the provider charges and what Blue Cross allows for those services. So out-of-network services can be very expensive, and we encourage you to always use in-network benefits as you currently do. The cost on this plan is $88.65 for the employee only, $566 for employee and spouse, $470.83 for employee and children, and $1,056.56 for the full family. The following is a video that explains the consumer-driven health plan in greater detail.
Meet Kate. Kate is not a psychic, but she is good at planning ahead. Kate has a health plan with a health savings account, also known as a Consumer-Directed Health Plan, or CDHP. With a CDHP, Kate can set aside money tax-free to pay for her health care. The savings account can help pay for things like Kate's dental checkups, prescriptions, and contact lenses or glasses. The savings account can also pay for unforeseen things, like treatment for a sprained ankle or a child who needs to go to a doctor. In fact, Kate can use her savings account to pay for many qualified medical expenses that might be coming up. Since this savings account is tax-free when used for qualified expenses, it helps Kate save money on healthcare. So who needs a psychic? With a CDHP, you can plan for your healthcare costs ahead of time. And that's a fortunate thing.
As mentioned in the video, under the CDHP plan, you can open or add to an existing health savings account. This is a special bank account where you're able to fund your medical expenses using pre-tax dollars. You'll make a monthly contribution into your account, and you can use that money to pay for your medical expenses. At the end of the calendar year, any money that's left over is yours and will roll over to the following year. Laredo ISD has a relationship with HSA Bank, which is one of the largest HSA banks in the country. This is all they do. They don't do anything else. It's a great way to make sure that if you have to meet your deductible, you've got some money and enjoy some tax savings at the same time. This video will give a little more detail on the health savings account.
In a perfect world, medical expenses would always be affordable. But in reality, they cost a bundle. Consumer-driven health plans help you save money while paying for uncovered medical expenses with tax-sheltered funds. And because CDHPs cost less than traditional plans, previously uninsured people can finally afford the coverage they want. There's a plan that fits you perfectly. From HSAs and high-deductible health plans to HRAs and flexible spending accounts, consumer-driven health plans put you in charge of your healthcare. You decide what procedures, services, or medications your funds are used for. And you can start small. There's no minimum contribution. While we fully manage your employer's CDHP, we also make these plans manageable for you. Online enrollment is easy. Our debit card accesses all your tax-free benefits. And our mobile app makes submitting claims and checking balances a breeze. So if your employer doesn't provide a CDHP, take charge. Encourage your employer to contact us today.
New for 2021 is an HMO. The following video gives you some more detail on exactly the way an HMO works.
Meet Sally. Sally likes roller derby, but she doesn't like unexpected medical bills. With an HMO plan, Sally goes to a select group of doctors and providers. It can save her a lot of money. Her HMO keeps her monthly premiums low. And Sally can get free or affordable health care for services like flu shots or physicals. If Sally needs a specialist, her doctor can refer her to one. When Sally receives care from providers in her network, she has the peace of mind of knowing that her co-payments will be manageable and predictable. An HMO plan makes it easy for Sally to receive quality care while also saving her money. So Sally can keep taking the hits while her wallet doesn't.
With the HMO plan, which is also known as a Health Maintenance Organization plan, it's very similar to the Gold plan that we discussed earlier. You do have your annual deductible of $3,500. You do have your co-insurance of 30% and your maximum out-of-pocket of $8,150. Your preventative screenings are still covered at 100%. Your office visit copay with your primary care physician is $40. Your specialist is $60, although a referral is required from your primary care specialist. Your urgent care copay is $75, and virtual visits or MD Live is not available on the HMO plan. Your generic drugs are very similar, are identical to the Gold plan, which is $20 for generic drugs, $40 for preferred brand name, $60 for non-preferred drugs, and $250 for your specialty drugs. If you notice, there's no out-of-network benefits. The HMO plan that is available is for Texas residents only and services that you receive in Texas, and there's no out-of-network benefits. So you have to really consider which plan works best for you. If you notice there in the yellow highlight, each person must designate a primary care physician or a PCP at the time of enrollment. You may make PCP changes monthly if you want to do that. The cost for the employee only is $135.23. Employee and spouse, $707.66. Employee and child or children, $592.84. And employee family, $1,294.19.
So some frequently asked questions about HMOs versus PPOs. Do I need a primary care physician? Yes, under the HMO, you do have to have a primary care physician. They serve as the coordinator of all of your health care. And that coordinator is documented within the Blue Cross Blue Shield and system. So they will know who your primary care physician is. Under the PPO, you do not need a primary care physician. You can change doctors or go to your primary care physician at your discretion. Do I need a referral to see a specialist? Yes, under the HMO you do. The primary care physician will complete some paperwork or documentation letting Blue Cross Blue Shield know how many visits you're approved for or what time period you're approved for. Under the PPO, no referral is required to see a specialist. However, keep in mind that many specialists manage their practice by requiring a referral from another doctor. If you currently have a specialist or doctor that is out of network, can you continue to receive care from them and be covered? The answer to that is no, not under the HMO, and yes, under the PPO. So HMO plans do not cover care from out of network physicians, hospitals, or facilities. The only exception would be in the case of a true medical emergency, which is defined as a life or limb-threatening condition. Under the PPO plan, yes, you may see a specialist that is out of network, cover that cost at your expense, submit it for reimbursement, and have the lower coverage cost. The HMO plan is much less expensive than the HMO. PPO plan is going to be a higher cost. Of course, a CDHP plan is going to be the lowest monthly cost.
Know your network. Again, this gives you just an idea of looking at the three options that you have available to you. On your monthly deductions, on your Gold PPO, it's going to be higher than the HMO Blue Essentials. And as Tina mentioned previously, it'll be the lowest cost under the Silver PPO CDHP. Your annual deductible is higher on the Gold and Blue HMO Blue plan than the Silver PPO. There is a copay available for your visits on the Gold PPO and the Blue HMO Blue Essentials. There are no copays on the Silver PPO. You've got to pay the full fee of the visit. Coinsurance is covered at 30% under the Gold PPO and the HMO Blue. LISD will pay 100% of the bill after you've satisfied your deductible on the Silver plan. And that deductible, we said, is $3,000. Is a primary care physician required for the Gold PPO or the Silver PPO? The answer is that is no, it's not applicable. But on the HMO Blue Essentials, a PCP or primary care physician is required, and you must select one at the time of your enrollment. For specialist office visits, there's no referral required on the Gold plan or the Silver PPO plan. There is a referral required for the HMO Blue plan. Your out-of-pocket maximums are higher on the Gold PPO plan and the HMO Blue plan. They are lower on the Silver PPO. If you are on the Gold PPO or HMO Blue Essentials plan, you can participate in a flexible spending account. However, if you sign up for the Silver PPO plan, which used to be the basic plan, you can set up what they call a health savings account, or HSA, and that's a video that you watched at the previous slide. Network coverage is covered nationwide on both the Gold PPO and the Silver PPO. On the HMO Blue, it's Texas-only network, so that's important for you to note. Is there out-of-network coverage? Again, For the gold and silver PPOs, there is out-of-network coverage available. There is no out-of-network coverage available on the HMO Blue plan. And last but not least, the out-of-pocket costs. It's higher out-of-pocket for the Gold PPO and the HMO Blue Essentials plan. Your out-of-pocket cost is lower on the Silver PPO CDHP plan.
When selecting a primary care physician, you can use this link to find a provider that's in the network. You will register either as a member or a guest. If you've registered previously, continue under your current membership information, or if you want to take the time to go ahead and enroll, there's a lot of wonderful information on the Blue Cross Blue Shield website. Otherwise, proceed as a guest. Select PPO Choice Network if you're looking for gold or silver plan options, and select HMO Blue Essentials if you're looking for HMO providers.
Again, your 2021 medical options are listed here, and at a glance, you have a chance to look at the Gold PPO, the Silver PPO CDHP plan, or the new HMO Blue Essentials plan. Annual deductibles are listed there, $3,500 for both the Gold PPO and the HMO Blue, $3,000 on the Silver PPO. Coinsurance is covered at 30% on the Gold PPO and the HMO Blue Essentials. There's no coinsurance on the Silver PPO plan. The maximum out-of-pocket on both the Gold and HMO Blue Essentials plan is $8,150. It's $3,000 maximum out-of-pocket on the Silver PPO CDHP plan. Again, if you're in network, we strongly encourage you to stay in network as often as possible so that you're not caught with unexpected charges from out-of-network providers. Office visits are covered at $40 for the Gold PPO and for the HMO Blue Essentials. Specialists are covered at $60 for the specialists and the HMO Blue. Urgent care is covered at $75 copay for the Gold PPO plan and the HMO Blue. And remember that virtual visits are covered, the MD Live program are covered under the Gold plan at $35. That is not covered on the HMO Blue plan. If you notice on the Silver PPO, there's no office visits, there's no copays for urgent care specialists or virtual visits. The member would be responsible for those fees, up until they hit that $3,000. On all three plans, preventative screenings are covered at 100%, and then your prescription drugs on both the Gold PPO and the HMO Blue plans are covered for a $20 copay for generic drugs, $40 copay for preferred brand name, $60 copay for non-preferred brand, and $250 for your specialty drugs. Notice that all medications on the Silver PPO plan are covered at 100% after the deductible is satisfied. And your monthly deductions are listed there below for the employee only, employee and spouse, employee and child or children, and employee and family.
So what happens if you choose not to make any changes to your health plan? If you're currently on the PPO low plan, which has a $3,000 deductible, you will automatically be moved over to the Gold plan with a $3,500 deductible. If you're currently on the PPO CDHP with a $2,700 individual deductible, you'll be moved over to the Silver CDHP plan with a $3,000 individual deductible. If you're currently on the High plan with a $1,500 individual deductible, you must elect a new plan. If you do not elect a new plan, your coverage will be canceled January the 1st of 2021. The new choice for January 2021 includes the HMO Blue Essentials. Please remember, all applications need to be turned into the Veterans Field Ticket Box at 2200 Santa Maria from 9 to 6 p.m. October 12th to October 23rd, 2020, Monday through Friday.
Who can join the plan? All full-time Laredo ISD employees and their eligible dependents are allowed to participate in the benefits program. We support all of our Laredo ISD families, but it's important to follow the LISD policy on eligibility of dependents when adding coverage. Several documents will be required to provide and confirm eligibility, and those include things such as your marriage certificate, your common law certificate, your Social Security card for your spouse. If the spouse does not have access to medical coverage through their employer, then they're eligible to join onto the plan. For dependent children, they can be covered up to the age of 26. A birth certificate is required, a valid Social Security card, a medical child support order, court orders, adoption papers, guardianship orders, or a marriage certificate is required if you're adding your stepchildren. Several people always ask us, can I include my parents on the plan? Or can I include my brother or sister? The answer is that is no. The federal government and the plan itself does not allow us to include our parents or our siblings. It's only your spouse and your dependent child or children up to the age of 26.
So how do I sign up? What do I do now? Step 1 is to click on the following link and open the enrollment application on your web browser. Download it and print it, and after printing the application, you can turn it in at Veterans Field Ticket Box Monday through Friday, 9 a.m. to 6 p.m. from October the 12th to October 23rd. Please make sure all fields are legible and filled out correctly. It's very important that you use neat handwriting. If you have any questions, please don't hesitate to call us at Laurel Insurance at 956-724-9083, and one of our representatives will be happy to assist you. Also, feel free to send us an email at info@laurelasos.com, and we'll gladly reply to you and help you make your decision.
Blue Cross Blue Shield provides a mobile app that you can put on your devices. So for your Apple products or your Google Play products, you can download this app just by going to the App Store and locating it. Or you can also text the following letters, which are BC, BS, TX, APP, to the number 33633. By downloading the app, it gives you access to in-network doctors. There's information there in English or Spanish. You can access your claims, see how much of your deductible has been satisfied. You can have access to your temporary digital ID card. You can log in with your Face ID or your fingerprint ID. And there's several of additional information that's available to you on the app. We highly encourage you to download the Blue Cross Blue Shield Texas mobile app for your devices.
One of the important items that's included in the Blue Cross Blue Shield online program is a health risk assessment. It takes 7 to 14 minutes to complete the questionnaire, and it gives you a lot of great information that you can use when you take to your physician's office, talking points, targets that you can shoot for in terms of your health and wellness, text message alerts, fitness programs, tracking for fitness and nutrition, and integrates with a number of devices. We really encourage you to take advantage of this member wellness portal that's available at no cost to all LISD employees.
Dental plan. Several of you have already enrolled on the dental plan, which is underwritten by Delta Dental. There will be no changes to your current dental plan. So if you're already on it, everything will continue as is. For those of you that are interested in looking at the dental plan, it's an excellent plan. Once a year, if you need to meet a deductible, it's available for $50 per individual or $150 for family. Children are eligible to be on the dental plan up to the age of 26. They cover your basic services, which are 2 cleanings a year. That's covered at 100%. Basic services such as fillings, simple tooth extractions, those are covered at 80% after you've met your deductible of $50. And then your major services are covered, and those include things such as crowns, inlays, onlays, periodontics, oral surgery. That's covered at 50% after you've met your deductible. There is a 12-month waiting period for your major and your ortho services. But if you've already been in the plan, everything will continue as it is, and everything will work out great. We strongly encourage you to go twice a year to get your teeth cleaned, which are covered at 100% on the Delta Dental plan that we offer here. The maximum that the plan will pay per person per calendar year is $1,000. The cost for this plan is $23.94 per month for the employee only, $42.28 a month for the employee plus one dependent, so that could be you and your spouse or you and one child, and then $67.84 a month for the whole family. Those are your plans that are available.
So how do you sign up for the dental plan? You're going to use the link below to download the LISD enrollment form, or if you downloaded it for the medical plan, you'll use the exact same form. Fill out the information, indicate which plan you would like, and keep in mind that you don't have to have the same coverage for medical and dental. So if you're the only person covered under your medical plan, but you want to include your family on the dental plan, you can do that, or vice versa. Again, don't hesitate to call our office at 956-724-9083 with questions. And once you've finished your applications, you can take them over to the Veterans Field ticket box from 9 to 6, October 12th to October 23rd, Monday through Friday.
Voluntary life and accidental death and dismemberment insurance. Laredo ISD provides all of their full-time employees with $15,000 of basic life insurance. Several of you already have the additional or the voluntary life insurance. There are no changes to that plan as well. So if you're already covered, everything will stay the same. For those of you that would like to sign up, you can get up to 6 times your annual earnings, up to $500,000. This benefit is reduced to 65% of coverage at age 70, and it is also reduced to 50% coverage at age 75. Coverage ends at termination of employment or retirement, and there are options for you to convert it or to take it with you if you change districts. Spouse voluntary life, the maximum amount that the spouse could get is $100,000. The spouse amount cannot exceed 50% of the employee coverage amount. So in other words, if the employee has $100,000, the most the spouse can get is $50,000 worth of coverage. The spouse rates are based on the employee's age, and the spouse coverage ends at age 70. For your child or children, you can also get an individual plan for up to $10,000 per child, and the children are covered from birth to 26 years of age. If you are signing up for insurance for the first time, it is subject to underwriting and it is not guaranteed issue. And there's information on the next slide that shows you how you would sign up. Again, you could click on the following link and get the life insurance enrollment form along with the evidence of insurability form. And you can use one form for both the life and disability applications if you're going to be applying to disability. You download and print the applications. After printing the applications, you can turn them in at Veterans Field ticket box between 9 a.m. and 6 p.m. On the following dates, October 12th through 23rd. To learn more about the benefits or to look at the rates, there's a rate sheet that you can access, and there's plan highlights. Please try to make sure that all the fields are legible and filled in correctly. And if you have any questions, please give us a call at 724-9083 or shoot us an email at info@laurelasos.com.
The next voluntary benefit that we're going to talk about is disability insurance. Disability insurance protects your income if you're not able to work due to an accident, an illness, and for women, maternity claim that prevents you from being able to work. As an LISD employee, you get to choose the amount of disability insurance that you want, up to the maximum of 66.7% of your income. Each person can customize the benefits according to what best meets their needs. Your benefit duration is to age 65 or Social Security normal retirement age. There is a pre-existing condition clause on the policy. For a period of time following the effective date of your insurance, they will not pay for any services that started in the 3 months prior to joining the plan. Now, keep in mind that this benefit is for off-the-job accident and injuries only. You can also select the waiting period or elimination period that best meets your needs. You have 6 choices that vary according to the number of days you will wait before the policy begins to pay. Choice 1 starts paying you after 0 days of injury in 3 calendar days of sickness, all the way to choice 6, which pays after 90 days of injury or sickness. And these are calendar days, not work days. So it's important to take that into consideration. Obviously, the sooner you have the policy begin to pay you, the higher the premium will be. This is a voluntary benefit, and it does not automatically adjust with your income. So it's important to update your disability insurance every few years to make sure that your coverage stays in line with your salary. If you're interested in enrolling in the disability insurance, download the disability enrollment form, the evidence of insurability form as well, complete the information, and submit it with your paperwork to Veterans Field Ticket Office. We would ask that you submit all your paperwork together at one time. The disability rate sheet is included in this link as well, and the disability plan benefits highlights are included as well. If you have any questions or you need help, please don't hesitate to call our office at 724-9083.
The last plan we have available is the Cancer Specified Disease and ICU plan. Several of you already have this plan. This was formerly underwritten by Humana. Now it's underwritten by MetLife. And what it is, it's a group cancer plan that will pay lump sum cash benefits for certain procedures, screenings, diagnosis, things of that sort. The payments are made directly to you, and they can be used for any purpose you desire. It has a first diagnosis benefit, which is a one-time benefit payable if a person is diagnosed with internal cancer, or if a person is diagnosed for a specified disease. Things such as radiation, radioactive isotopes, chemotherapy, immunotherapy, all of those are covered with no lifetime maximum. We do have a waiver of premium benefit that after 60 continuous days of disability due to your cancer or specified disease, the company will waive premium starting on the first day of your policy renewal. There is a pre-existing limitation clause, and what that means is during the first 12 months of a covered person's insurance, losses incurred for pre-existing conditions will not be covered. During the first 12 months following the date a covered person makes a change in coverage, that increases his or her benefits. The increase will not be paid for pre-existing condition. After his 12-month period, benefits for such conditions will be payable unless they are specifically excluded from the coverage. And we encourage you to please refer to the policy, which will be attached on the next slide, so that you can look at the details. Certain specified diseases such as ALS, encephalitis, lupus, Lyme disease, meningitis, epilepsy, and several others are covered under this policy in the specified disease area. There's also hospital intensive care confinement benefits that you may choose, and you can choose whatever amount suits your need, ranging from $325 all the way up to $625 per day. If you end up in ICU for any reason, not just for cancer, but a heart attack, a stroke, a snake bite, a car accident, this hospital intensive care confinement benefit will pay you a benefit. Once a person reaches age 75, those benefits will be reduced to 1/2. How do I sign up for the MetLife Cancer Plan? You'll click on the following link and get your enrollment form, download and print the application. You can see the rate sheet and the highlight sheets, and then once everything is done, you can turn it in again to the Veterans Field Ticket Box Office from anytime from 9 a.m. to 6 p.m. on October 12th through October 23rd, Monday through Friday. Please feel free to contact us at 724-9083 if you have any questions.
The last benefit we're going to talk about is your vision plan. This is also a voluntary benefit that's available to all LISD employees and their dependents. We have 2 options, a platinum and a gold plan. The copay is $10 for your eye exam and $25 copay for your materials, which is waived for elective contact lenses. You can receive an eye exam every year and replace your frames and lenses every 12 months under the Platinum plan or every 24 months under the Gold plan. The premiums are below. You can see that there's a slight difference in cost from the Gold to the Platinum. If you're interested in enrolling in this plan, instructions are on the next slide. But I do also want to make sure we caution you that the frames that are available are a select group of frames. They are not every frame that's in the optometrist's office. Obviously, for $6.65 a month, we're not able to provide designer frames, but there is a good selection of frames, and it makes eyeglasses very affordable, especially when the full family wears eyeglasses. So if you're interested in the vision plan, you can use the same LISD enrollment form that we used for the medical and for the dental. Add the information to the form. After printing, take the application with any other applications that you have to the Veterans Field ticket box. If you have any questions, please don't hesitate to call our office, 956-724-9083. This slide here gives you a quick and easy link to all of the different enrollment forms that you might need. Please download the forms that you need, fill them out neatly, and return all applications together to the Veterans Field ticket box at 2200 Santa Maria Avenue from 9 to 6 p.m., October 12th to October 23rd, Monday through Friday. If you have any questions, please don't hesitate to call our office. We want to remind you that all these changes are effective January the 1st. It's very important to check your January 2021 paycheck to verify that everything is indeed correct, and be aware that your medical plan changes will be reflected in your December paycheck. So once again, if you're currently on the low plan, you will transition to the Gold PPO plan. If you're currently on the PPO CDHP, you'll transfer to the Silver CDHP. If you're currently on the High plan, you must elect a new plan as your coverage will be terminated December 31st, 2020. The HMO Blue Essentials plan is a new option for January 2021 and will be available starting January the 1st, 2021. If you have any questions, as always, please don't hesitate to call our office or send us an email. Telephone number is 956-724-9083, or you can send us an email at info@laurelasos.com. Thank you so much for your time. We appreciate you listening to the information we have to share with you.